into our last couple of sessions. Very excited about this. Our next topic is how to make the case for investing in mental health. As with any program you want to introduce, you always need to have a business case and a way of justifying the investment. It's hard to do, especially sometimes in the space of mental health and well-being. In this session, we'll explore how to find the tools that are right for your people, how to gain support for your mental health initiatives, VOI versus ROI, and articulating the advantages of mental health technologies in your workplace. We've invited two wonderful clients to the table, Spomenka Krizmanic, I hope I said that right, from Trobe University, and Katie Ward from Thornton. Welcome to you both. We'll be discussing how they accomplished this at their respective organizations. I'd like to introduce my partner in crime, Jordana Cheong, also known as JC. She leads our client success team in APAC and is responsible for delivering the value and success of the Unmind platform. JC was my first hire and has been with Unmind since we opened operations in Australia last year. And before her journey at Unmind, she spent 5 years at Reward Gateway. So welcome to the team, Katie and Spo. It's great to see your face, and thank you so much for joining. Really looking forward to this session. JC, I'll pass it over to you.
Thank you, Zach. Thank you, everyone, for joining us today. I hope you enjoyed the session this morning or the afternoon for our friends in New Zealand, and that you're looking forward to hearing from Scott Gooding shortly. It definitely won't be one to miss. Over the next 20 minutes, I'll be exploring with our panelists their experiences around making a business case for investing in mental health, and we'll also look to touch on that all important but very fluid question of how to define what success might look like in this very unique space where the results are often qualitative. We'll then have the remaining 10 or 15 or so minutes reserved for questions at the end. So please do keep the conversation going in the chat. It's been brilliant to see you all sharing your experiences today. If you do have any questions for our panelists, we'd love to hear from you. So I encourage you to fire away, and please do so in the Q&A function rather than chat so we can make sure that we see them, and we'll get to as many as we can at the end. So I'm delighted to be joined by two wonderful guests today, both of whose organizations partner with Unmind. And from working very closely with them both, I know you're both deeply passionate about supporting your team's mental health and overall well-being, and that you have plenty of experience in what it means to develop that passion into a tangible solution or solutions for your businesses. So first off, Katie Ward, who is the Head of Talent and Organisational Development for Thornton, Australia, and also a registered psychologist. So Thornton have been a partner of Unmind since the beginning of August, and have seen really fantastic engagement with the platform and with embracing the concept of shifting to preventative rather than reactive care in that time. And we're also joined by Spomenka Krizmanic, Senior Manager for Health, Safety and Wellbeing at Trobe University. Trobe went live to their people with Unmind in early June, and took a softer launch approach that, based on previous experience, better suited the infrastructure of their 3,000 strong organisation. And I know that SPO has advocated long and hard around the importance of taking a proactive approach to mental health care, and knows better than anyone the experience of what it finally means to have the right tool in the hands of her people. So SPO and Katie, thank you so much for being here today. As everyone in our audience will be painfully aware of, the last few years have impacted every organisation and individual in some way as it pertains to their mental health. So it's brought workplace mental health to the forefront of the conversation, and it will have featured in discussions in almost every single business. So it may have been a question of adjusting existing policies or creating urgency around new initiatives. And in other cases, it really might have just opened the discussion. So we're looking forward to hearing a little about the journeys that you've been on. So first off, in that knowledge that every organisation is at a different stage of evolving their mental health strategy within their business, perhaps we could start on the topic of articulating the advantages of doing so. So Katie, I might come to you first and wonder if you can tell me a little bit about the mental health strategy and at Thornton and how that came to be, and what the awareness or sentiment around mental well-being within the organisation was already.
Yeah, great. And thanks for having me, Jordana, and the team at Unmind. So it probably all relates back really to our broader firm strategy and purpose, which at Thornton is to care for our people, our clients and communities, and support them to thrive. So really with that in mind, mental health and wellbeing is a critical part of that, and so we've always had the support of our CEO and exec team and the broader partnership group. So really, I guess that's always a key part of our discussions around, okay, well, what do we need to do? And I think as a firm, we'd already been investing a lot in work and working proactively with our EAP, our employee assistance provider. So it was about how do we take it to the next level. And we've had campaigns and awareness days, like Are You OK Day and Mental Health Week coming up. So that's something we've been doing annually. But we really wanted to think about, okay, well, how do we pull something together that's more holistic but also proactive? And as you mentioned just in that introduction, Jordana, around we can't ignore the fact that with the pandemic over the last 18 months, it has raised, I think, everyone's awareness around mental health and the importance of mental health. So I would say that, as well as while we already had a good foundation, it has actually accelerated maybe some of the things that were already in our strategy, such as things like skills and awareness training for our leaders. So yeah, that's probably where we're at the moment. We already had a strategy, but we've kind of accelerated some of the components and making sure we're trying to be proactive.
That sounds great. Love that. Thank you. And how about you, Spo? And what was the genesis of La Trobe's mental wellbeing strategy? And was there any particular data or feedback that you collated in the organisation that gave you the impetus to engage in that area?
Yeah, thanks, Jordana. I guess we've always understood that psychosocial hazards are an industry risk factor in higher education, and that, of course, needs to be managed. To help us better understand, we actually hired a clinical psychologist who worked alongside with us together to develop a strategy which addresses these risk factors. And I guess we took a two-pronged approach. One is to look at it from an organisational level and all the things that we can do across the structure of work design. And then also very much at the individual level, what can we do for people to, I guess, improve their literacy around mental health and their practices. We also have drawn from our wellbeing and engagement survey data, and they were occurring on a biannual basis. So, we've drawn a lot of data over a reasonable period of time to form a view that that support is required for individuals to improve their own knowledge and of mental health, and to shift their practices and behaviours in support of good mental health. So I guess it's a combination of all those things, but very much strategy-led and two-pronged strategy-led. Organisationally, what we can do around work design; individually, what we can do around changing people's understanding of mental health. So it's a contemporary platform, and alongside with their understanding, shifting practices and behaviours that support good mental health.
Thank you for that. That's brilliant. And it's fantastic that the organisation has invested in that expert resource in a clinical psychologist. And I definitely hear you when you say you're trying to balance the needs of the individual with the organisation, and the understanding that they're two separate things that are completely intrinsically linked. And it's definitely been a tightrope that lots of my contacts have been walking alongside you, especially in recent times. So just moving on, we on the panel, and obviously everybody listening in here today, are incredibly passionate about the mental wellbeing space. What I'd love to hear a bit more about is how you were able to garner support for your ideas and initiatives that you are planning within your organisation. So, Katie, you've recently launched Unmind to your people at Grant Thornton with great success so far. Would you be able to expand a little bit on the wellbeing ecosystem at Grant Thornton and why you felt that there may be a space for an additional solution?
I like the word ecosystem. I think it does speak to, really, it's about, as Spo mentioned, it's about what can we do at an individual level and an organisational level, and certainly our ecosystem around wellbeing is really based around our workplace mental health and wellbeing strategy, which, similar to Spo, we took our internal data. So we launched an engagement survey this year. We've taken data from that. We also had pulse surveys, particularly during the lockdowns. We've regularly worked with our teams to try and get that in the moment feedback. How are people going in terms of hybrid working or kind of grappling with coming back to the office? So very much our strategy's been based on research, benchmarking with external, getting external support as well. And so based on that, our ecosystem is around our strategy, which is about addressing 5 key goals. And I know Spo talked about 2-pronged approach. We came up with 5 key goals, and I'll have to just refer to my notes to remember them all. But essentially, it was around, firstly, improving our understanding of mental health conditions and roles and responsibilities. So that goes to kind of what can everyone do, not just leaders, but what are everyone's roles in relation to mental health in the workplace. Building a supportive workplace, so that's really fundamental. Ensuring all of our behaviours, policies and practices support team member wellbeing, and proactively reducing risks. And then finally, it's around promoting positive mental health and wellbeing. So really our ecosystem is about trying to drive those 5 key goals. And we felt that, and I'm sure you know, it's probably something that Spo's grappled with as well, is there's no one thing that's going to address all of those 5 key areas. Well, that's my personal belief anyway, but really based on the research, that it's about how do we create and curate, and we've worked really hard to curate a kind of a package of resources and initiatives that will address these things. So really it's about any initiative or solution we consider has to be addressing at least one of those goals. And so really Unmind, which we launched in August, was something we thought that really aligned to that proactive and preventative goal around promoting mental health and well-being, really at that, and empowering the individuals to have access to those resources.
Perfect. Thank you for sharing that breakdown. It's really helpful to be able to understand how you're able to identify where there may have been a gap. And yes, if only if it was so easy as to have one solution for absolutely everything. But yes, I imagine kind of breaking it down in that way would have been instrumental in being able to clearly define and communicate in black and white what was needed. Spo, I know from working closely with you over the course of this year that you've advocated very strongly for solutions and initiatives and that can support your people. How did you go about taking your executives on the journey with you and getting that buy-in across the business?
Yeah, thanks, Jordana. Great question. I guess our executive and our council, University Council, which is the equivalent of a board, have always shown interest in managing the broad range of health and safety hazards and the risks that they represent. So in a sense, they've been keen to engage, not only from a data and an analytical review perspective, but also from a strategic and that high-level operational perspective. They actually want to know and they want to understand. They're keen to understand the nature of those psychosocial hazards that we have within our organisation. That is a natural part of the way that we work, and our plans and activities to actually manage these risks. Now, of course, I'm using a lot of risk language and safety language because that's my background and my perspective, but I'm really respectful of the language that psychologists use, which is a little different. I just wanted to make that point that I'm coming from a particular angle. Likewise, the business is keen to better understand. So if we're talking about our own business, we're now delving into our business structures, if you like. The business is really keen to understand and to manage the factors for good mental health, because they can be at the sharp end when things are difficult. So they're definitely reaching out and asking for support and help and wanting to understand. They want to understand those factors of mental health, across the continuum, all the way from poor to good, and how the good mental health can actually be cultivated. There's also genuine interest and engagement because it's known to be a wicked problem, a little bit like Kate just mentioned, and people in all aspects of the business can be affected. So that's kind of understood as well. I guess our people want to better understand mental health and what can be done to cultivate it, both at that personal level, so that people can change their understanding and their actions, and also within their teams, that is how they can actually support each other.
Thank you for that. It's great to hear that you have the board support, which left you kind of free to explore your options, and it's such a crucial point about having to completely intrinsically understand what the particular psychosocial hazards for La Trobe's people specifically are, in order to be able to identify the right solution for them. I guess this kind of takes me nicely onto my next point, which is around identifying the right solution. So the mental health and wellbeing space has accelerated in a huge way in recent years, and there are a myriad of solutions available. So I'd love to hear a bit about when you were scanning the market for a solution that would truly support your people, what were the sort of key criteria that you had in mind? Spo, if I just come back to you, because it just links in nicely with what you were just saying.
It does. Thank you so much. Yeah, we have quite a bit of experience of scanning the market over, I guess, a 3-year period, so pre-COVID, if you like. There's certainly a difference out there between the plethora of those feel-good but vacuous wellbeing apps. There are plenty of those around. And then in comparison to apps such as, or platforms such as Unmind, that delve deeply to develop the knowledge and skills for users while delivering that rich content and in a really engaging way. So that's what we were really looking for. We were looking for rich content. We're looking for new and innovative ways of being able to deliver it. And we have quite a discerning audience, if you think about it. We have all of our academics at the university. And of course, we have our own School of Psychology and Public Health. So we do have our own internal experts. So you can't get bigger critics than that. We particularly found that the podcast from Unmind was a great example of how messages can be delivered into bite-sized chunks in a contemporary mode that people are really happy to connect with. So, I mean, for me, one of the big hooks was the podcast. I know that our people engage with it really well, and I certainly know that younger demographics, that's the way to go with them. Also, the tools that are within Unmind, so the daily doses, the check-ins, the fireside chats, on and on and on. There are just so many different ways to engage and to keep engaging, because that's the point of all this. It's not this, one stop, I go in a couple of times. It's the continuous engagement. It's the immersion of it. It's the thinking about it. It's the reframing the way we consider mental health for ourselves and for the people around us. And that, of course, leads to changes in practice and the reflection, which is what we're trying to achieve here. From an organisational perspective, I'm really pleased. We've only been using it, as you said, live since June, but there's already aggregated data forming in the background that provides some real-time feedback. So we no longer have to wait for annual or biannual surveys. We can actually just go in and have an understanding of the organisational pulse. It's exactly what I did a few weeks ago. And I get some understanding of where are we in terms of our happiness index based on the people who are currently using it. Where are we on some of the other indexes? It's just terrific to be able to go in and get that aggregated real-time data. There are so many tools that can be used within the Unmind platform, which we really like. And I know that we have been using it, our team certainly have, to engage other teams, say engaging people at the start of their meeting or during their business meetings, and that's to cultivate that community of good mental health practice. So at the moment, we're modelling those behaviours with the idea that the different business groups will take that up and pick that up and start using the Unmind tools for themselves within their own meetings and groupings. We've also recently had some real interest from we have a marketing group that reach out to students who are in year 12 and looking towards university study, and they're high achieving students. And they were looking to reach into and to be able to use some of the tools in Unmind. So we're just setting that up at the moment. So there's quite a bit of interest within our own community. And that really feeds back to this idea that what we have chosen as a solution is really meeting our requirements as a business.
That's so wonderful to hear. Thank you for sharing that. And I definitely agree. The sort of sharing a tool experience pre-meetings, we're a big fan of that at Unmind, and it really serves a dual purpose of not only just putting us all in the right mindset for it, but gaining exposure to what it's all about, but also just increasing that openness around looking after our mental well-being and making it part of the company's DNA, which is great. And Katie, I'll come to you for your thoughts on this as well, just before we move on to the VOI versus ROI question. And we do have some questions coming in as well. But yeah, if you're able to share any learnings about what you found on the path of finding the right solution for your people, we'd love to hear.
Yeah, great. And I will confess that I actually did a little bit of an Unmind bite-sized thing right before this panel as well, because I did a bit of the box breathing just to kind of, you know,
Yes.
get into the zone. So that was something I learned, a bit of a bite-sized tool. So yeah, I mean, as I mentioned earlier, kind of any solution for us, it has to address at least one of our mental health and wellbeing goals, and very much Unmind is in that proactive, you know, promoting mental health and well-being from that proactive perspective, but really similar to SPO, you know, having a discerning audience. Yeah, we also have a discerning audience who are, you know, I think having evidence-based tools really helps to sell it in, as well as, yeah, really love the podcasts and the continual ways to reinforce having conversations around mental health and destigmatizing conversations around mental health. But I think one of the things that really drew us in was the evidence-based tools and resources that, you know, it's clinically based and developed. And I know a lot of the resources have had clinical psychologists kind of to support in that creation, as well as just general conversations with great people doing great work in this space. So, you know, the fact that it was bite size, we could give access to everyone, and you know, you can have it on your phone or on your laptop, and so it's available at any time, at any place. And as I said, you know, you can pull one out just before a meeting if you need to. But it's something, to Spo's point around, we'd love to create a bit of a momentum. So actually it's about building proactive habits. Obviously support in the moment is great, but how do we build those proactive habits? So that's something that we thought the tool absolutely addresses, both in the moment support as well as helping our individuals create those proactive habits. And again, that organizational data, as Spo mentioned, the capacity to be able to have that kind of temperature check or well-being check, and understanding that then allows us to maybe tweak or refine our strategy or where we're placing some of the focus and resources. So, you know, for example, if sleep comes up as a bit of a challenge, how do we promote some of those resources, or do we need to kind of look at, you know, what's going on for our people in that? So that's just, I think there's loads of great things. And finally, there was one, you mentioned community, Spo, but I think that really resonates with us as well. And one of the things that really stood out for us when working with Unmind initially and talking through was the capacity for a +1. And I don't know if that's been talked about yet, but the functionality to actually any of our individual team members can offer the access to a friend or family member, and I think that's fantastic, and that really aligns to our purpose around community and supporting our communities to thrive as well. So I think a variety of factors, and we've had really great engagement. So you mentioned, Jordana, we've launched in August, and so far we've had about 35% uptake, which I think is pretty good within kind of a few weeks of launch. So we hope to see that trajectory go up, but we've also had really good uptake from the +1 function as well. So the ripple effect to our broader community is fantastic, and another key outcome for us, I would say.
Yeah, thank you for sharing that. And definitely +1 is something that it definitely makes us really glad that we're able to offer that out. I think it tied in so well with Are You OK Day activities as well, didn't it? In terms of being able to offer that resource out. And it's so easy to recognize when someone that we care about is in need of some support, but maybe not so easy in ourselves sometimes. Perfect. Well, thank you for that. So on to our kind of last section of the main discussion. It's all about ROI. or is it actually? So traditional metrics for ROI have always played an important role in kind of measuring the efficacy of services provided to employees, but such an elusive target when it comes to mental health and well-being. Lots of us may have seen that important statistic out there that for every dollar invested in mental health initiatives, businesses see a $4 return from reduced absenteeism and increased productivity. But actually the goals of every organisation vary quite a lot. So I'd love to hear your views on how you view value on investment versus return on investment and what you're looking to sort of achieve for your people. So Spo, I'll hand it over to you first on this one.
Okay, thank you very much. I guess our focus is very much on value on investment. I mean, I've previously mentioned that managing mental health in a workplace setting is a wicked problem. It's something that I think we collectively understand at the university. And a wicked problem, of course, has no start, it has no end, as we all know, and with a multitude of inputs that create such enormous complexity. So if you think about it, trying to create a direct line of sight for just return on investment, in contrast to value of investment, is actually too narrow and, in our view, far too simplistic. Value, after all, is the sum of the whole, and we are, of course, dealing with a wicked problem. So from our perspective, it's much better to consider the value proposition by how our collective actions to manage those psychosocial hazards and risks can actually improve, as I keep saying, the mental health literacy at the individual level, practice at the individual level, and the changes that we make, of course, to support all that at the organisational level through work design, structural changes, and structural support. So focusing on value actually enables us to shift those practices that support a culture where wellbeing is actually nurtured, and nurtured through the symbols that we create in our organisation, the kind of rituals that we undertake, that support good mental health, the stories that we share with each other, and the heroes that we hold up to high regard. That creates the kind of culture that actually actively protects people from harm, which is what we're trying to achieve here. And then that value has an impact on the bottom line, hence that return on investment. So it's a bit circular, I guess. Focus on value of investment first, that then leads you to return on investment.
That's such an excellent point about sort of value being the sum of the whole and coming full circle back to the impact on ROI. Thank you for that. And Katie, I'll come to you as well, just for your thoughts on this hot topic.
Yeah, I suppose really similar to Spo again here. I think we're in sync. I mean, I guess we go to ultimately what are we trying to do in this space, and for us it's about kind of supporting, promoting and protecting the mental health and well-being of all our people, and so when you think about that, it's less about kind of the return on investment and more about what is the culture we're trying to create. And that's, we think about the people experience and it's around making sure that everyone feels psychologically safe, or there is high levels of psychological safety in teams, that people feel included. So people feel that they're able to speak up and discuss mental health without stigma. And importantly, it's about people can know how and when to access support early. So it's all of these kind of things that we think are really important. So ultimately it's around addressing the culture, but also I think Spo talked about increasing people's awareness and understanding. So a big part for us is not just knowing that you have resources you can access, but it's also about increasing all of our awareness and understanding of what mental health is. It's on a spectrum. It's not you have it or you don't. It actually fluctuates, etc. And what are some of those individual, team and organizational factors that can influence it? So for us, some of that's easy to measure, some of it isn't. And so, some of the measurements we can look to are things like our pulse surveys, engagement survey. We certainly measure things like psychological safety and well-being. We've now got Unmind to give us a bit of that macro level data. But other things that we want to think about in the broader context is kind of team performance. We have leadership 360s, and those kind of measures as well, in terms of it really is about the culture and the value that a healthy, mentally healthy workplace and culture has, in terms of knowing we're going to retain and develop and attract people to our organisation.
Yeah, great. It's really helpful to hear how you kind of tie in that qualitative feedback with quantitative data in order to get that more complete picture. And I'm so glad to hear you both talk about culture in this way, because it's that culture of open conversation and inclusivity that we're all aspiring to all the time, and to keep going. It's a conscious effort to continue it on, and it's ultimately how we'll sort of keep tackling that stigma that still exists around mental health. So thank you both so much for sharing your insights. We've got a couple of minutes left, so I might throw it over to the floor for some questions. One of them that came up was around, so you've both kind of talked about pulse surveys and engagement surveys, and someone's asked, how did you ensure engagement in your surveys? Was there hesitancy, and what feedback from the surveys particularly stood out for you? So maybe Katie, I'll come to you on this one first, and then move over to Spo.
Yeah. And by engagement in our surveys, I'm presuming you mean kind of participation.
I think,
I mentioned we launched our national engagement survey this year, but last year, particularly during the pandemic, we ran a few pulse surveys. And do you know what? I think engagement was there because a few reasons. It was really because we were genuinely interested in what our people had to say, and obviously things were very topical. So our pulse surveys were really obviously pulse in terms of short, but very much linked to how can we better support you? How are you feeling around either working from home or coming back into the office, or going back onto client sites, because obviously a lot of our teams are with clients rather than necessarily in the office. So it was very much, we had a lot of engagement because it was really pertinent, and a lot of people were grappling with these issues, but also you've got to do something with the feedback. So there's no point in just continually asking people for feedback. So I think there's a phrase that I can't remember where I came across, but it's not about survey fatigue, it's a lack of action fatigue. So if you feel like people aren't actually responding to your surveys, it's probably because people aren't seeing you taking action from the feedback. So I think critical, and it's something that we still wrestle with sometimes, but in terms of the speed of action, and why we might take action on some things and not others, because you might get feedback and you think we're going to take action on 5 things, but we can't do 10 things. So I think it's really around continually communicating what we're doing with the data and why we're asking for that data. So that was really kind of how we got good uptake around this in our wider engagement survey. So I hope that answered the question. I think there was another part to it, but I might let Spo have an opportunity.
That's all good. I think that's great, and it definitely the whole following through thing. I'm sure we've all been had an experience in our lives where something was maybe promised, or we had expectations and they weren't met, and it has such a negative impact. So certainly can understand that. Spo, I'd love to hear your thoughts on this one as well.
Okay, we actually launched a wellbeing survey back in February this year, but it was I guess it was supported by a wellbeing reference group that we put together, which was a mix between the academics from the School of Psychology and Public Health and colleagues, and I guess members of my team from Health and Safety and colleagues from HR. And so we formed this reference group, and the way that we then launched the survey was in response to the work of the reference group and to provide some information, some input back to us. So it was really well received. We I guess did a lot of upfront explanations about what we were looking for, and I guess the broader intentions of the Wellbeing reference group, and then we did certainly follow up very quickly after the results came in. We then ran some listening sessions afterwards. We ran quite a few of those, 11 actually. So that was a really great follow-up, which started at the end of Easter and went through till the end of May. And since then, we've crunched that out as well. And we've just been providing the data back to people. So we've been really open with all of that. It's now gone to our business partners. Our business partners have now provided narrower data to the different business units, and they are working through their own plans. So that's kind of how we've done it, so that it's really visible from the beginning. It's visible through the process of gathering and crunching, and then it's actually given back to those individual teams as well, and people are inputting into those plans and helping to enact those plans. So that's our journey.
Fantastic, thank you. I think it's, yeah, the explanation around transparency kind of all the way through, the context at the beginning, and then what the actual data is, etc. I can see Zach's popped up on the screen, which probably means I need to wrap, even though we could feasibly keep talking for a really long time.
Like the Academy Awards when I show up, I'm down there playing music under the stage.
Yeah, I can hear the music rising. Thank you so much, Katie and Spo, for sharing your experiences with us today around this. I know it's an ongoing and ever-evolving journey in terms of supporting your people. So wishing you all the best, and I'm looking forward to continuing to partner with you on it. Thank you to our audience as well for listening. Hope you enjoy the rest of the event, and I'll hand back over to you, Zach.
Thank you, JC and Spomenka, and Katie, thank you. Katie, I also did the box breathing right before the start of this as well. You can always imagine with a few hundred people staring at you on the screen, you kind of need to calm, the blood and the heart
revealing
rate.
Our secrets now. Yeah.
Yeah, exactly. So,
I won't tell you what my Fitbit heart rate is.
Yeah, I've got an Apple Watch on. I've been monitoring it all day right now. Thank you very much. And thank you for being customers of Unmind.